health and well-being. Within the United Nations Convention on the Rights of the Child is the declaration that all children have the right to experience a healthy start in life and be offered a standard of living that meets their physical and mental health needs. Scientific evidence shows us how health and well-being is determined to some extent by the way in which children's brains develop in terms of the relationships and the responsive care that they receive. Children's early experiences of a caring environment have a direct influence on their self-esteem and sense of well-being as they develop and grow.
There's a huge link between relationships and children's mental well-being. The very first relationship is about how you develop your sense of yourself, you know, what their self-esteem is, who am I as a person, do people value me, through all the, you know, the responses they get and the feedback. So for staff, it's really important that they know that that's a key bit in how they help those young people develop, particularly young children who don't have that perhaps from elsewhere.
Staff working with young children should provide the kind of support and guidance that helps families to build capacity to work towards achieving the most positive outcomes.
I think it's really paramount that practitioners are always looking at the emotional well-being of the whole family. And certainly in their direct work with parents, there is a three-way relationship which is about looking at the well-being, the level of confidence, how they feel about themselves, and can practitioners look at any opportunity to harness that. So it's not just about having parents in helping at one specific area. It's starting where the parents are at and looking at how can we actually best support the parents.
A lot of our families that come to hand in hand could be attending because they're isolated, they've just moved to the area and they don't know anybody, or it could be a bit more serious where they might have postnatal depression. In the centre, we appreciate that this is very difficult for the parents to walk through our front door even, so we can incorporate home visits and we can come and visit. And then we encourage the parents to come into the centre where they can have group support. There are other mums, there are other people out there that are having the same problem, so we encourage the mums to come in and discuss their issues, and we can help with that. We do courses about self-confidence, we do baby massage to help with bonding with your child, and we do lots of arts and crafts that can encourage mums to not feel stigmatised and not have a label. They are individuals, and we like to help them see that they are individuals.
The big thing behind what I do really is about raising self-esteem, raising confidence through creative work, and also through helping parents express themselves. At the moment we've been looking at parents' aspirations for their families, so we've been relating that and doing wish books with the families where we get parents to think about, you know, what are their aspirations, what do they want for their children, what are their wishes, and then putting them down in a book, which it kind of works on all different levels. They're learning new skills, they're using new materials. There's a lot of discussion going that people don't necessarily even notice. You know, for example, one of the wishes is that people, you know, they wish their child to be confident, comfortable with themselves. So that, you know, creates all sorts of discussions about how the parents feel, and maybe, you know, they find difficulties with confidence and so on. So how do we bring that out in children? How do we, you know, it really just starts up all sorts of conversations about confidence.
I feel it's helped me in a lot of confidence. I was employed, and then I got paid off from my job, and it's gave me confidence in being able to go out and actually find another job and get back out into the workforce, and just confidence within myself as being a parent. It can boost, it has boosted my confidence in doing that.
Scottish Government policy frameworks, including the Early Years Framework, Equally Well and Achieving Our Potential, all seek to address disadvantage and improve the life chances of our youngest children by tackling social, health and educational inequalities through prevention and early intervention. The frameworks represent a strong commitment to a partnership approach where the promotion of health and well-being relies on staff, parents and agencies working together to achieve the best start for all children. The policy frameworks offer a consistent approach and equally well makes clear that staff working with young children and families must not only respond to the consequences of health inequalities, but also, where possible, tackle its causes. Through primary care services, Health for All Children 4, commonly referred to as HAL 4, supports the delivery of preventative health care and health promotion. Health visitors have a key role to play in supporting and promoting the health of children and families, and it is important that staff use this pivotal service. Parents play a central role in supporting children to develop physically, emotionally, socially and cognitively. Staff working in early years settings are in a strong position to be significant and positive role models for children and parents, and they should be aware of their responsibilities in the promotion of health and well-being. By promoting healthy living messages such as toothbrushing, healthy eating, physical activity and hand washing, staff help children and families to achieve the most positive health and well-being outcomes.
It's extremely important to promote children's health and well-being at this early stage. We encourage outdoor play, we constantly encourage children to be energetic. Every day the children are out playing. We encourage children to wash their hands, be independent at toileting. Their snack time is very healthy, and of course with parents we encourage parents to look at our snack board, what's on offer today, so that they constantly are being reinforced as well, that children have to have a very good food to encourage their growth.
A key person who knows and understands the child and family best is well placed to contribute meaningfully to this partnership approach. Nutrition and physical activity. A prevention and early intervention partnership approach with parents, staff and other agencies is key if babies and young children are to develop lifelong healthy eating habits.
Health and well-being is a critical part of the curriculum for all our children. We would look at the nutritional aspects of that for the child, both in terms of snacks and meals. It's about rewarding, it's about praise, it's about encouraging children in a very positive way. We would encourage the families to support that in terms of what they would do with the child and extend learning away from the nursery to home. And we would work very closely with our colleagues in health and social work to ensure we give the parent the best chance and obviously then that child the best chance in life.
The Scottish Government promotes breastfeeding as the optimum way of ensuring that babies have the best start in life and receive all the nutrients they need. Staff can support parents who are seeking guidance about breastfeeding by signposting them to useful publications, helplines or to the health visitor.
We know that secure attachment actually and left-handed feeding roughly correlates, because if you're feeding on the left side, you've got left eye to left eye contact, and the left eye communicates to the right brain. So that's why I mentioned the left side. There's a reason for that. The baby's getting nice physical contact, the mother's relaxed, so the baby's relaxed, because of course the baby will pick up all the mother's subliminal signals. The mother's enjoying the feed, she's able to focus her attention on the task at hand and not be distracted, so she hasn't got other things on her mind, which a more stressed mother might have. She's only got the baby on her mind. The baby's enjoying the feed, gradually gets through, finishes when he or she feels like it, and it's a complete experience with a beginning and a middle and an end. And that baby's had a good experience, and in terms of the brain wiring up, what's happened is neurons that fire together wire together. In that baby's sort of internal representation of the mother is mums, or relationships as it will be, make you feel good, they care for you, you can feel safe, you can relax. Now next door we could have a mother who, for whatever reason, can't keep the baby in her mind. She can't hold the baby in her head because she's overstressed and she's vulnerable. She's struggling with a multiplicity of risk factors which are impacting the relationship, and these can be social, like poverty or racial intolerance. They can be immediate, like an inability to tune into the child because of her own background or trouble with a violent partner, or they can be in her own past, such as being in care or coming from a background of maltreatment or poor parenting herself, but for whatever reason she can't hold the baby in mind, and maybe she can't even tolerate unconsciously giving the baby a good experience because she did not have it herself. And so therefore you get the paradox of mothers sometimes being jealous of their own children because they're being asked to do something for their child that nobody did to them. And these mums, of course, need even more understanding and support. They certainly don't need blaming. And perhaps it's important to just do an aside here and say there's no such thing as a bad parent. All parents do the best for their babies that they possibly can. No parent sets out to be a bad parent or a difficult parent, but all parents bring different resources. And as you know, all of us who've been a parent know there's nothing more stressful and exhausting than being a mum or a dad. But this poor mum and this poor baby are getting a completely negative experience. The baby doesn't feel settled. The baby may be being prop-fed. The mother isn't making eye contact, so there's no excitation of the right brain. The baby just is doing a mechanical task, gulping it down, is probably going to get colic. So that'll make it, again, a more difficult baby to settle, which will make the baby even less satisfying from the mum. And you can see the whole thing going off into that predictable negative spiral. And yet they're both having the same experience, these two babies. They're having a feeding experience. But what's being wired up in each baby's head, the structure of their mind that's being put in there, could not be more opposite.
Staff may also wish to promote, for example, the Baby Cafe initiative by providing a dedicated area for breastfeeding mums and displaying relevant materials.
Go to the breastfeeding group every Wednesday. I also attend another one on a Thursday. It's been a fantastic help. I've breastfed 2 boys already and used the facilities right through, and wouldn't know where I would be without it, to be honest. It's really, really good. The girls are fantastic. The friends that I've made through the group have been fantastic, and the information that you can get just through talking to other mums as opposed to looking in a book is just out of this world.
Babies and young children need a healthy, balanced diet to support brain function, as well as other aspects of physical development. As soon as babies have been weaned onto solid foods at around 6 months, they can choose from a range of healthy foods and drinks supported by adults who encourage them to try out new tastes and textures. From the earliest days, children can experience the joy of physical activity through play, both indoors and outdoors, and in all weathers. These experiences offer important opportunities for the development of fine movements, gross motor and social skills. Opportunities to experience planned risk and challenge through play encourage children to gain confidence in their abilities and in making decisions.
We are really clear now that health and well-being are absolutely crucial for very young children's development and nurture. The research now tells us that the things that happen to babies and young children in their first 3 years are absolutely fundamental foundations for what happens later. We've got our good old sort of structure that we've had for decades and decades about children's mental, emotional, social, physical well-being chunked up into 4 things. And it seems to me that it's become incredibly unhelpful to think about those 4 things separately. We need to acknowledge and think about the integration of children's development and how it all works together. That the most important thing for people's well-being, for very young children and for adults, especially mothers with children under 5, is all about feeling that you can both make a difference for yourself, in other words, to look after yourself, to care for yourself, but crucially also to care for other people. So it's about caring.
Prevention. One of the principles of getting it right for every child is keeping children and young people safe. Emotional and physical safety is fundamental and is wider than child protection. Prevention of infection is crucial as babies have an immune system which is not fully developed, making them particularly vulnerable to infection. In early years settings, where adults and children are in close contact, infections can spread very quickly. These risks can be reduced by ensuring good hand-washing practice, high standards of personal hygiene, and maintaining a clean environment. Frequent hand-washing is one of the single most important ways of reducing the spread of infections and preventing ill health. Children are particularly affected by second-hand smoke as their bodies are still developing. It is important that parents understand that the only way to protect children from second-hand smoke is to have a smoke-free home and car. Staff can provide relevant information for parents on matters relating to prevention, safe environments and avoiding unintentional injury. How does your current practice ensure that you remain up to date in relation to key health improvement messages? How can you further develop partnership working in your setting to promote healthy lifestyles?